Hi, good evening, everyone. Thank you for joining us. We're back again for another COVID-19 Community Town Hall. Our Town Hall series is presented by UP Health System Portage. I'm Steve Elmer. I'll be joined shortly by my co-host, Kelly Kam. We're both college professors and members here of the Health Research Institute at Michigan Tech. We want to welcome all of our viewers watching tonight on the Zoom webinar and all of our listeners tuning in on 97.7 The Wolf. If you are listening and tuning in tonight and would like to join us on Zoom, you can go over to thewolf.com and click on the link to join us on Zoom and see some of the visual content that we're showing tonight. I want to take a minute and recognize our sponsors, which include UP Health System Portage, the MTech Smart Zone, Upper Peninsula Power Company, and Aspirus. It's also important to recognize our Town Hall Organizing Committee, which consists of the Health Research Institute and the Center for Educational Outreach. We really appreciate the support of our local sponsors and our campus partners for making this possible. You know, the mission of the Health Research Institute is to support health-focused education and training for our students, research for our scientists and engineers on campus, and also to engage with the community. Tonight is our 5th Town Hall in a series of 12 that we're having every Thursday evening right here on Zoom and on 97.7 The Wolf. The overall goal of the series is to increase our awareness about COVID-19 and how it impacts our health, our community health, and society at large. There was recently, just in the past week, a report from the World Health Organization encouraging countries and all of us to make sure that we're communicating the credible information out there and to stop and reduce some of the misleading information out there. So our town hall really fits nicely with that. Tonight, we'll be bringing in a series of experts from our community here to provide that credible information that we're looking for. If you happen to miss any of our previous town halls, you can go to our website at mtu.edu/health-research, and you can download the recorded versions from the previous weeks. For example, last week we learned about COVID-19 testing and contact tracing, virus transmission, and a little bit on vaccines. Tonight we're switching gears and moving on to a new topic. Our topic tonight will focus on acute care with COVID-19 and long-term recovery. With that background in mind, I want to bring in my colleague and co-host, Dr. Kelly Kam. Dr. Kam is an epidemiologist here on our campus. She's been heavily involved with the contact tracing efforts. So Kelly, welcome back, and let's get going with our next town hall.
Thank you. Yes, I think this session will dovetail quite nicely with what we had last week, where we were talking about being able to test and find our cases and hopefully slow the spread of transmission in our communities. But unfortunately, this disease can be very severe, and there are a percentage of people who will end up with hospitalization and needing long-term care and long-term impacts of this disease on their health. So today we have Dr. Clayton Charles from Aspirus and Dr. Timothy Labonte from UP Systems Portage, our two systems that we have up here in the Upper Peninsula in our region of the Western UP. So I welcome both of you. Just a little bit of a background of, well, not a background, an update from last week. So as many of you in our community have seen and experienced, transmission in our community is increasing greatly. So in Houghton County, we have now over 400 cases of COVID-19, significantly increased from even from last week, and it's expanding and increasing in many of our areas in the Upper Peninsula, as you can see in this map here. So those red areas are the areas where we've really got a lot of increase in cases, and the whole entire UP right now is a risk level D, which is a measure from the Michigan State Safe Start Plan, which indicates that we have greater than 70 cases per million people, which is, you know, strong. It's a higher rate than what we're seeing in some of our downstate areas. So certainly there is reason for concern about this and the impact this has on as we have more cases, and that leads to more severe, you know, more opportunities, unfortunately, for severe disease and hospitalization. So again, we introduced this last week or the week before, and I wanted to show you this again of looking in particular, this is from Johns Hopkins COVID website, of looking at where our cases in Houghton County again are in the previous 14 days. So the last time I showed it, we had that spike that was about 10 days prior, which was certainly related to Michigan Tech's testing of some high-risk populations, and so we saw an increase in cases. But it was a single spike, and then we were seeing leveling off. What we're seeing here now is certainly an increase in cases, and it's continuing each day. And so this is where we have real concerns about spread in our community, and the reason that we have then moved to higher risk levels and more community mitigation procedures. So I personally am a parent of 2 elementary aged children, and they are home with me right now because our schools have closed. And that was something that happened just right at the end of our session last week, that we got the news on that mitigation procedure and policy. So this is the data behind why that decision was made, that we're trying to slow the spread of disease in our communities by reducing the number of transmission events that can occur. And again, as part of that mitigation at the community level that we're doing, so the National Guard will be here on Saturday, working with our health department and the state health department, our local health department, and Michigan Tech is partnering in there as well, to make community tests available. So it's happening up at the Gates Tennis Center in the parking lot there. Tests are available. This is from the Western UP Health Department website. So go to their website, uphd.org, to get more information on this, but there is no pre-registration. Testing is available in a drive-up method to be able to find out and understand what's going on with transmission in our community at this point. And then our Mythbuster for today, again, thinking back towards our school closures, both Michigan Tech has switched to remote classes for much of our classes, as well as the pause in our K-12 in-person education, that this myth that only older people are more susceptible to COVID-19, that is most certainly not the case. Young children, teenagers, young adults are all at risk of becoming infected with COVID-19.
Great, Kelly. One quick question for you. I know this has come up a couple times now. Can you define and tell us more about this rate of positive tests and this positivity as we're seeing these percentages pop up, especially here and downstate in Wisconsin?
Sure. So the test positivity is a measure of what kind of transmission is going in our community. So the actual calculation is the number of positive tests divided by the number of tests that were done. And usually that's done on a daily basis. So it's a pretty basic calculation. But what it means is it gives us an idea of how much transmission is going on and how much we're able to pick up disease that's going on. So the lower number is better. Below 5% is at least the goal, but in different communities, you might want to have a lower positivity. Certainly, if a community doesn't have a lot of medical resources, then you might want to have even a lower test positivity than that 5%. And the high numbers can come from 2 different scenarios. Either we have a large number of positive tests, meaning that we have a lot of transmission going on and there's a lot of people who are infected, or we have a low number of tests being done and that the only people that are being tested are those who are symptomatic. And with this disease, we know that it causes mild disease and even asymptomatic disease in a lot of people. So if we're only testing the people that are really severely symptomatic, then we know there's a lot of transmission that's going on that we're not able to detect. And again, as we learned last week, the way that we can stop this spread is by identifying the people who have the disease, getting their contacts, and keeping their contacts under quarantine so that they don't spread the disease further. If we don't know who has the disease and our test positivity is high, then we're not able to identify who those people are in order to get their contacts under quarantine. So this information we use from a public health perspective within a community with other information as well to help determine what kind of community mitigation procedures we're going to put in place, like what has been done with closing the K-12 schools and Michigan Tech going to a higher risk level and going remote.
Now, Kelly, one other question before we move on to our next speaker. What would you say is the major difference between the spread of COVID back in March compared to now here? And can you put that in the context of locally living in the UP as things were different in March than they are now here?
Well, a lot's different, certainly. So back in March up here, we weren't having a lot of transmission. It hadn't reached here. We were protected in a way by having our communities being a little isolated. There wasn't much movement and migration of people. And so we were able to keep the spread low because we didn't have it. It hadn't gotten here yet. And like many other rural areas are experiencing around the country, we're now experiencing this increasing growth from many of our health and public health and medical care practitioners. I would leave it to the professionals here, but I think we've heard from our public health professionals that they were on alert back in March and working hard in March, and now we're seeing this surge in cases. And so the exhaustion level of all of our practitioners, as well as the fatigue within our community. We all want this to be done with, but it's not going anywhere anytime soon. And so we really have to buckle down and do, as I heard, the 3 W's: wash your hands, wear your mask, and watch your distance.
Well, thank you, Kelly, for the brief public health update. We'll try to do those just about every week. For those watching on Zoom, we do have a number of helpful websites up for those listening. I'll just read these off really quickly. Again, these are websites where you can get some of your questions answered, keep up to date on the latest COVID-19 related information. That includes the Western UP Health Department website, also the Michigan.gov website, the CDC website. We have the Michigan Tech Flex website, and then of course we've added both Aspirus and UP Health System Portage, their websites, to our list here. And also bear in mind that pretty much all of these websites, at the very top, there's a COVID-19 ribbon that you can click on. For example, if you go to UP Health System Portage website, talk about procedures. If you are coming into the clinic or hospital, Aspirus has the link to the testing that Dr. Cam talked about this weekend coming up on Saturday. So we'd encourage you again to connect with those websites that are providing the credible information. As a reminder, as we're listening to our speakers tonight, if you do have questions, there are 2 ways to send those in. We'll give you the first half of the town hall to formulate your questions, send those in using the Q&A button at the bottom of the Zoom webinar. Or if you're listening, you can email those to us at townhall2020@mtu.edu. Next, we'd like to welcome Dr. Clayton Charles. Dr. Charles is a hospitalist and a physician specializing in internal medicine. He works at Aspirus up in Calumet. So Dr. Charles, thanks for being here, and we're looking forward to your brief update for the community.
Well, thank you so much for inviting me to your town hall meeting this evening. I want to thank especially the good folks at Michigan Tech University, Drs. Elmer and Dr. Cam, and the good folks at 97.7 FM. So we're going to assume, first of all, that you've had a test done at a facility and you were tested for the COVID-19 test. And what happens next? The next thing is you'll be notified in a timely fashion, and you will be advised to self-quarantine and to have those that were in the closest contact with you to also self-quarantine as well. And then a big question that comes up frequently is who is most at risk for severe illness? Not just who's at risk for illness, but who is most at risk for severe illness. And unfortunately, here we go again, it's going to be the elderly. Those who are 65 years or older are at a higher risk category for having severe illness. Additionally, those with chronic diseases are also at high risk for severe illness. And these would include those with cardiovascular disease like congestive heart failure, coronary artery disease, if you've had a stent in your heart or a pacemaker or any type of cardiac device implanted under your skin, you're likely going to be in a high risk for severe illness. If you have diabetes mellitus, if you have any chronic lung disease, maybe COPD, chronic obstructive pulmonary disease, which encompasses chronic bronchitis or emphysema, you're in a higher risk category. Those with pulmonary fibrosis or any sort of immunocompromised status. Maybe you're a recipient of a solid organ transplant. Maybe you have other diseases where you take immunotherapy, immunomodulation therapy. Maybe you have lupus or rheumatoid arthritis or Crohn's disease or ulcerative colitis, and you take biological medicines to help deal with that disease. Then ultimately and unfortunately, you are immunocompromised. So you are at risk of having severe illness. We also have patients, if you have cancer or on chemotherapy, especially those with hematological malignancies, people with blood cancers like leukemia or lymphoma, or even lung cancer, you are indeed at a higher risk for severe illness. If you're dialysis dependent, you have chronic kidney disease and you need dialysis on a every other day or so, you're going to be at a higher risk for getting not just the disease, but the severe version of the disease. If you're morbidly obese, if you have morbid obesity, or if you are an active smoker, you're also going to be at a higher risk for severe illness. Another question comes up is, when does a patient need to be hospitalized? Well, you need to be hospitalized if you have any need for hospital level care or hospital level monitoring. Let's be reminded that the fact that most people that get COVID-19 are going to be asymptomatic or have mild disease. You're not going to be severely ill requiring hospital level of care or monitoring. The vast majority of times you're going to do well. But if you're in this special category of people who are immunocompromised or have chronic diseases or elderly, then you in particular are at risk of having severe disease and needing hospitalized level care. Why do you need hospitalized level care? Is to halt or maybe stop a disease progress, stop the disease from progressing or getting worse, maybe to reverse the disease process. Or sometimes you have diseases where you just have to wait it out. You might have symptoms, but you might need mitigating of those symptoms so the disease can run its course. So those are 3 simple reasons why, if you're in that category, you might need to come to the hospital and be seen by an ER physician, or if it's even more severe than that, you may need to be admitted to the hospital to stop or halt at the progression of disease, to reverse a disease process, or to mitigate symptoms that you already have. What are some of these symptoms that you should be looking out for? Number 1, if you have a fever that's greater than 100.4 degrees Fahrenheit, persisting more than 24-hour period, and you've done something about it and is not getting better, I think you need to visit the nearest healthcare facility. Again, if you have a fever that we in the medical fraternity describe as a temperature of 100.4 degrees Fahrenheit or greater, and you've been initiating mitigated therapy like trying to stay adequately hydrated, taking Tylenol or Advil to help break that fever, and it's not gotten better over a 24-hour period, you need to visit the ER or your nearest healthcare facility so we can get a handle of this. Persistent fevers are usually a sign of something markedly wrong or something brewing under our noses that we need to take care of. Coronavirus, COVID-19, is notorious for causing pneumonias, but not every single pneumonia needs to be seen in the ER or to be seen by a healthcare professional. And pneumonia is described as someone having a fever, chills, a productive cough, and some shortness of breath. But not all pneumonias are created equally. If you have a severe pneumonia, then you need to be seen in the ER or by your healthcare facility. So what exactly are we talking about? You're short of breath. You have increased work of breathing. You feel like you have to work harder than usual just to breathe normally. You feel like you can't catch your breath. You do normal activity, but all of a sudden, after normal activity, you feel like you just ran a mile. Those are times when you probably should be seen by a healthcare facility. You have shortness of breath with minimal exertion. You can't speak in full sentences. You have to stop mid-sentence and catch your breath. This is when you probably should be seen by someone in a healthcare fraternity. If you have chest pain, new chest pain or chest pain that just won't go away, you probably should be seen by someone in a healthcare facility. Feel like your heart is racing and you're at rest. You're not doing anything active, but you feel a funny sensation in your chest and you feel like your heart is racing, you probably should be seen by someone as soon as possible. COVID-19 can also cause strokes. So if you have stroke-like symptoms, certainly, under any circumstances, you have stroke-like symptoms, you need to be seen in the ER. Those symptoms include confusion, weakness in some part of your body. Maybe you might have some tongue deviation, or maybe all of a sudden you have bowel or bladder.
See, we might be experiencing a little technical difficulty there with our Zoom connection, so we'll keep everything going here. Kelly, I'm going to ask you a quick question. We'll see if we get Dr. Charles back on. There's some questions coming in from the community already. Very interesting question here. how long will it take for cases to plateau or level off here and eventually go on the downward trend from your perspective?
Well, it all depends on what we do. If we continue to behave without consideration for transmission that's happening where we might not know that we're exposed to someone, then we're going to continue to have increases. If we can change our behaviors, even just for a couple of weeks, and make sure that we're keeping our, as Dr. Helt mentioned last week, keeping our pods small, that this break from school, keeping kids at home for a little bit, reducing the number of exposures that they're having in the classrooms, and then we can get this disease a little bit more under control, and then we can get back to the idea of being able to identify, test, identify, isolate, and contact trace to be able to get those cases down. But it is on the upswing, and it will take some time to level off. It's not an easy fix of today and tomorrow.
Okay.
We have Dr. Charles back again.
Great, thanks. I think we've worked through our technical difficulties here and got Dr. Charles back on. So Dr. Charles, if you can hear us, you have the platform here.
I can hear you loud and clear. Okay, so just moving on, I want to assure the community that here in the UP, particularly Houghton Hancock here, we have the facilities, the infrastructure, and the personnel that can adequately and appropriately deal with anyone who has COVID-19 symptoms that needs to go to the hospital, either at Aspirus or even at Portage. So I want to let you guys know that if you feel like you need to be seen, you can be seen. I can speak specifically for Aspirus Hospital. We have board certified ER physicians that are there 24 hours a day, 7 days a week. We're always there. If you need to be seen, you can be seen. If you're sick enough and you need to be admitted to the hospital, you have board certified physicians who can take care of you in the hospital. Do we have the facilities, the infrastructures to take care of you for whatever your needs may be? We certainly do. And in the event that we need extra help, we have the relationships with the people that you will need to be in contact with to get the care that you need. So certainly, if you need to be seen, don't hesitate, don't delay. You can be seen at our facilities and we can take care of you comprehensively, completely.
Dr. Charles, I'm going to come in with a question here. I think this is a really good question. You know, talking about the symptoms for the flu and COVID-19, there certainly is some overlap, but definitely some differences. Can you let our audience know, you know, how do you know when it's the flu versus COVID, and how do you know when do you come in, even if it's the flu?
Okay. So obviously there's some major overlap between the flu and COVID-19. There's several non-specific symptoms like a cough or a fever or a sore throat. These are really non-specific symptoms that can be associated with multiple different diseases. But a couple of things that we've noted with COVID-19 is that the loss of smell and taste is distinctly associated with COVID-19. Just because you have symptoms doesn't mean you need to be seen in the ER. Because you have symptoms, you may want to get tested to confirm the diagnosis, and that's certainly okay. But because you have symptoms does not mean you need to be seen in the ER or to be admitted to the hospital. And we have different resources here on the webinar, and certainly we can direct you where you can get tested without even having to go to the ER facility, or you can call ahead of time and speak to your primary care physician where you can get tested. But two of the most distinct symptoms that stand aside and stand apart compared to the flu would be loss of taste and loss of smell. All the other symptoms, unfortunately, overlap with pretty much the average run-of-the-mill pneumonia or the average run-of-the-mill seasonal flu.
Okay. Thanks, Dr. Charles. Just want to remind anybody just tuning in, we're here for the COVID-19 Community Town Hall. Our topic is acute care for COVID. We just heard from Dr. Clayton Charles from Aspirus, and we'll move on, getting a little different perspective about long-term effects and recovery coming up. Our sponsors tonight include UP Health System Portage, Aspirus, the MTech Smart Zone, and Upper Peninsula Power Company. Remember, you can send us your questions. You can email those to us at townhall2020@mtu.edu. If you're on Zoom, you can use the Q&A button at the bottom. Also a reminder that, as Dr. Cam mentioned earlier, there is a COVID-19 Community Testing Day set up for Saturday, October 3rd from 9 to 2 p.m. Right next door to us here at the Gates Tennis Center on the MTU campus. There are many questions over the past couple of weeks about where can I get a test, the cost, etc. This is open to anybody. There's no registration, no insurance needed, no prescription. You can show up and it's drive-up testing. Our next speaker is Dr. Timothy Labonte, who is a physician and hospitalist at UP Health System Portage. And again, he's going to continue on our theme tonight, talking about acute care and now focus more on long-term recovery. So Dr. Labonte, thanks for being here and welcome to our town hall.
Hi there, thanks for having me. I just want to take a minute to expand on, I think, what Dr. Charles had mentioned earlier. I think it's really important that the community understand that, that our local hospitals are capable and ready to take care of folks. Recently, there was some discussion by government leaders that there was concern about strain on our system here. And I think it's really important that the community know and understand that we are prepared, even in a worst case scenario, for such a surge. We have supplies in place. We have strategic plans. Our physician leaders meet with our administrative leaders, and we've developed incident command systems. And so, you know, I think it's just really important that the community understand that. I guess moving on, it's become such a broad topic. I guess, you know, one thing I wanted to discuss is what does the typical hospital course look like? What are some complications that can happen in folks that are diagnosed with COVID-19? And the median time to hospital admission is about 5 to 7 days. And that's been shown in studies from China and all over. And really locally, I can tell you that definitely is the case. We've had many people coming in testing positive at the time having mild disease, and then we see them back about a week later with severe disease warranting hospital admission. So I think that's one of the scary things about COVID-19 is that, you know, we have some predictors of severe disease, but you know, definitely it's not, there's no rhyme or reason about it either. And so, you know, at one point you can have mild disease and it can progress in some. And so, you know, we often tell people that come into the emergency room, you know, what signs and symptoms to look for that might be consistent with severe disease, and that they should come back to be evaluated. I would say the most common complication, so to speak, that we're seeing right now is respiratory failure. So folks needing oxygen, some folks needing to be on a ventilator for a period of time. The thing that's very interesting about COVID-19, and I've never seen this in any other disease that I'm, you know, that I've treated thus far, is the length of time that folks need oxygen. They, you know, they come in, they're feeling sick, they have fevers and some of the other symptoms that were mentioned previously, but those symptoms can go away, but the oxygen need persists. And so the length of time that these folks need to be in the hospital is quite longer than you might expect for the flu or some other type of virus or even a bacterial pneumonia. Those folks usually turn around within a couple of days. These folks need a lot longer time in the hospital. Even though they're feeling much better, they're still quite hypoxic, or what we would say is having low oxygen levels, profoundly hypoxic in some, but they otherwise feel okay, which is just very odd. Like I said, I've not seen something like that. In some people, that respiratory failure, like I said, can progress to the most common complication of COVID-19. It's called ARDS, or what we would consider calling ARDS in the medical profession. And it's called acute respiratory distress syndrome. And it's really an inflammatory condition that causes a lot of swelling within the lungs, a lot of mucus production, overwhelming anybody's ability to oxygenate or breathe normally. And so these folks end up on ventilators. We also see other common complications in the hospital. Dr. Charles mentioned strokes. but people can also develop blood clots of any sort in their lungs, etc. And there is ongoing studies showing a very high rate of blood clots in folks that are sick. We also see cardiac complications. People can come in with a primary complaint of chest pain and look like they're having a heart attack, only to find out that it's being caused by COVID-19. There's studies showing viral activity within the muscle of the heart, which is called myocarditis, which means inflammation of the heart, and can actually overwhelm the heart's ability to pump accurately. And so people can look like they're in congestive heart failure or having a heart attack. And again, that can all be caused by the virus as well. So what about recovery? So people with mild disease, meaning not hospitalized, the typical recovery would be about 2 weeks. However, there was an interesting study done on people that were treated in outpatient clinics, and 65% of the people reported a return to baseline within 2 to 3 weeks. So let's think about that another way. A third of people that were diagnosed with COVID-19 were still not back to their baseline within 3 weeks, okay? People with severe disease can take 3 to 6 weeks to fully recover. So these are people, these aren't necessarily just people on ventilators. These are just people that were in the hospital. And like I told you, they can be on oxygen for a couple of weeks or more. The same studies were looking at these folks, and again, they asked people that were in the hospital, and only 39% returned to their baseline in 2 to 3 weeks. So again, about a third of people with severe disease were still not back to their baseline in 3 weeks. And then 2/3 of people with mild disease. So those, in my mind, those are pretty astounding figures when you talk about return to work, you know, getting back to normal life, taking care of your family, etc. So those, I think, are very important for people to know. The most likely symptoms to persist in these people, I'm finding overwhelmingly, is fatigue. But people can report cough, nagging, chest pain. People, like I said, can go on to develop chronic heart disease or lung disease. We have a really large population of elderly people in this community, and by and large, what's difficult for them is just the deconditioning of being in the hospital. But I'm also finding that people, that elderly that have not been diagnosed with COVID-19 are also developing deconditioning because they're staying at home, they're concerned about getting the disease. So they're appropriately social distancing, but family members aren't coming over to take them out to eat or take them for a walk. They're not having their regular home health visits. And so, even elderly people without COVID-19 are coming in weaker than I've ever seen before. There's really nothing wrong with them. They're just inactive. And, we see it in the hospital for folks in their 80s. It can take 2 to 3 days only to develop deconditioning within the hospital. So this is a huge cost to our community and our healthcare system. The sickest patients that we see that are on the ventilators develop a high rate of what we call post-ICU syndrome. So again, not only are these chronic lung diseases, but these people go on to develop depression, anxiety, PTSD, and other cognitive issues related to being on the ventilator. One other comment I guess I wanted to make is, of course, most people are worried about dying from this if they're worried. And Dr. Kam had commented a little bit about the statistics earlier. So the spectrum of disease severity, about 80% of people will end up with mild disease. About 14% will end up with severe, meaning in the hospital, and only about 5% of people will end up with critical illness warranting like a ICU stay or mechanical ventilator. The case fatality rate's been reported about 2.3%. And none of them were among non-critical people. So these were people with severe disease or greater. but the case fatality rate is what's reported, but that's, can be a little bit of a misnomer too. So I'm not out here to scare everybody about all of the most ominous statistics. Here's a little bit of maybe good news. We report the case fatality rate, and that is unconfirmed cases. So it's the number of people with confirmed deaths of COVID-19 divided by the number of confirmed cases of COVID-19. But we know that there are a lot of people out there that are not tested who are asymptomatic. So really this in my mind, overestimates the mortality rate, because we're only including the people that were tested. There are so many more out there that are asymptomatic and not getting tested. So overall, that percentage rate is likely much lower. It's difficult to estimate a true mortality rate, again, because a lot of people are not tested. And the true mortality rate is really the likelihood of someone who catches the disease that will die from it. So again, that's difficult to estimate. Dr. Charles had talked about risk factors for severe disease, advanced age, all of the chronic health conditions, and I would certainly agree with everything he said. I thought he explained it very well. Couple of, other points that I want to say is, people of any age can develop severe disease. I can tell you locally, we've had younger people in the hospital. And interestingly, a lot of the people that I've been treating over the last couple of weeks do not have comorbidities, and they're middle-aged. So it really is kind of going against what we know about this. But it's definitely been a trend that I've been seeing. They're not people with COPD, asthma, heart disease. These people were previously healthy folks. So that kind of goes against what we know about it. But we also know that there are differences in geography. So people in different countries, different parts of the country can experience this differently. Lastly, I just wanted to say, because of the fact that we just don't know who can develop severe disease, we can't predict it perfectly. It just, we want to talk about the importance that we all need to be social distancing, wearing masks and washing our hands or using hand sanitizer. And the last comment about that too is there's studies out there actually showing disproportionate, that the disease is disproportionately affecting males and African Americans as well. So that's another trend that we're seeing as well. So it doesn't just have to be the elderly or those with chronic diseases. I think that's what I have.
Yeah, thank you, Dr. Labonte. I want to follow up on the deconditioning a little bit. So you mentioned in some of those severe cases, you are seeing deconditioning with the COVID patients and also those that are at home as well. How long does it take for those patients to recover from the deconditioning? Do they need additional physical therapy or respiratory therapy? Can you tell us a little bit more about that?
So it's variable. Like I said, though, there's studies out there showing that it only takes 2 days to decondition someone in their 80s in the hospital. So for some of these folks that I mentioned are on oxygen in the hospital for 2 weeks, the deconditioning to recover, we've had people on our inpatient rehab program for 4 to 6 weeks after being in the hospital for only a week. So the recovery can be actually quite lengthy for a lot of these folks. There's a few different options that they would have. One being inpatient rehab. So again, staying in the hospital, getting physical occupational therapy twice daily. Or for folks that are safe to go home, we can set them up with home health services that can have a therapist stop by. And then there are some people who live in assisted living facilities locally that make it a little easier for us to be able to set up those services for them to safely go home.
Okay. I'm going to open it up to the panel here. There's quite a few questions coming in on the chat and through email here. Let's start with Dr. Charles. This community member is asking about medications, therapeutics. If you're working with somebody in the hospital, we're hearing a lot in the news about different types of therapeutic medications and treatments. What are you currently using to help patients while they're in the hospital?
While the patient's in the hospital, that we use the routine medicines that associated with, specifically for COVID pneumonia, we're using the same medicines that we routinely use for the run-of-the-mill pneumonia. However, in addition to that, we've noted studies have proven that steroid therapy, which is usually not used for pneumonias, has been having more positive outcomes for patients with COVID pneumonia. And I'm talking about medicines like dexamethasone, prednisone, or solumedrol. Those are the 3 types of steroids that are specifically used that will help halt the progression or reverse the disease process in terms of COVID pneumonias. So in addition to the run-of-the-mill therapies for any pneumonia, which would be antibiotic therapy, breathing treatments like nebulizer treatments to help you open up your lungs, in addition to antibiotics, probiotics, we add specifically steroid therapy in the case of COVID pneumonias. I know there's a lot in the news that has been said about specifically the Plaquenil, the hydroxychloroquine. Studies have proven that they are not actually helpful. I know we've heard about Plaquenil, hydroxychloroquine with azithromycin. That combination has proven to be more harmful and not helpful. However, if you are sick enough to be admitted to the ICU or severely hypoxic, we also use something called remdesivir. That's another a medicine that is actually used. But before you even get to that point, we treat you when it comes to COVID pneumonias, we treat you with the routine COVID medicines, which are usually very adequate, but we also add steroid therapy, namely dexamethasone, prednisone, or solumedrol, which is adequate for treating specifically COVID pneumonias. And if your case is advanced beyond that point and you have to be admitted to the medical ICU because you're so hypoxic, your oxygenation levels are so low, we add remdesivir.
Okay. Thanks, Dr. Charles. Dr. Labonte, here's a question for you. This person's asking, if you get COVID and you do recover, can you get it again?
So there have been a few reports of people getting it again. But by and large, the honest answer is we don't know. But by and large, the feeling on this is that no, you cannot. However, there have been a few reports of people getting it a second time. I think we need to think of this like any other virus. Generally speaking, if you get the flu, you're very likely to not get it again, at least that flu season, that same year. Many other cold viruses, there are so many out there, and these viruses mutate so frequently that yes, you can get it again because your immune system doesn't recognize it the second time, so you get sick. COVID has shown some mutation in different areas in different countries, but the feeling right now is that it hasn't mutated enough in one area to where most people would get sick again. But, anything beyond that remains to be seen. We just don't know enough about it yet.
A quick follow-up question, Dr. Labonte, on the notion of the flu. Can folks in the community get a flu shot? And what would your advice be for those that are hesitant to come into the clinic for the flu shot? We've learned the past couple of weeks how important that is. Is there a drive-up testing or something remotely where they can get a flu shot outside or something like that?
I think there's a lot of opportunities to get flu shots in the community. I would talk with your primary care provider to make sure that it's right for you, but by and large, it should be right for everybody. I cannot push enough. Everybody should be getting their flu shot. If any year you ever considered it, this needs to be the year. And there are lots of different opportunities to do that, whether it's traditionally within your primary care office. There are clinics set up for people to come in and out. I think some of the local pharmacies are giving flu shots. So there are a lot of different options, but I think this is a good opportunity to kind of expand on that just a little bit. And I can't say this enough. People need to come in to the hospital to get their care. Like I talked about the elderly folks getting deconditioned because they're not leaving their house, we are seeing an uptick in other diseases that are much worse than they would have ever been before COVID. And the reason is people are not coming in a timely manner to get seen and get taken care of. And so often they're much sicker than they would have needed to be had they come in prior. You know, the hospital at Portage, you know, we are extremely safe. Everything is cleaned and disinfected. We all wear masks. We all wear eyewear with patients. We have, you know, plenty of PPE, N95 masks. And so there is absolutely no reason why someone should think it is unsafe to come in, whether it be for chest pain or whether it be for a flu shot. People need access to their preventative care. And people, especially with chronic diseases, need to be seen. And so, you know, please do not hesitate to come in if you think you're having a medical problem or if you need to have a flu shot or follow-up for any type of chronic disease.
Okay. Just want to remind our viewers and listeners, if you do have questions, you can send those in using the Q&A button on the Zoom webinar. You can also email those to us at townhall2020@mtu.edu. Next question is for Dr. Charles. Dr. Charles, this question came in from a community member. They're highlighting that Wisconsin, our neighbors to the south right now, are really feeling the brunt of COVID-19 with, I think, record number of cases and deaths and a real high positivity rate of 20%. Aspirus has clinics, not only here in the UP, but also Wisconsin. How are you guys sort of interpreting that and preparing, as it looks like some of the hot spots in Wisconsin are only a few hours away, for example, Green Bay?
So I think that's a wonderful question. I think we have to understand that although we're a big family in terms of the Aspirus network, we have folks here in the UP, are from the UP, live in the UP, function in the UP, so we're not necessarily traveling back and forth between Wisconsin and, let's say, Laurium. And migration is probably the biggest factor in terms of causing the surge in infection rates here in Houghton County. We have people from the outside coming in during the summertime, and we have return of students who've been many different places and coming and bringing the migration processes, facilitating of being vectors for the COVID-19. However, when we're talking about hospital personnel, the hospital personnel, we don't travel between Wisconsin, whether it be Green Bay or Rhinelander, and then work in Aspirus in Laurium. So we're a part of a family network, but we're distinct. And I think this is a good time to re-emphasize that we here in the UP at Aspirus and Laurium, we have the adequate facilities and infrastructure to take care of anyone that comes to our doors. In fact, I would all be 99% sure you would not get COVID-19 at our facilities. If I could say 100%, I would say 100%, but I'm a scientist. So I would say we're 99% sure you're not going to get COVID-19 at our facilities, but what you would get is the adequate care that you need should you come to our facilities, whether it be for regular pneumonia, a heart attack, infection of the skin or soft tissues, whatever your needs are, you can come to Aspirus, and we will be able to take care of your needs. You will not get COVID-19 from us, but if you do have it, bring it. We can take care of it for you.
Good to know. Kelly, let's just circle back on that positivity rate of 20%. You had talked about that earlier. How does that compare to other places, say here in the Midwest or nationally? I mean, 20%, is that high, low? You mentioned 5 earlier, but can you put that in the broader context for us?
That is very high. I can't tell you what, off the tip of my tongue, what we're experiencing in other places, but that is a very concerning amount of people. So that's 1 in every 5 tests that are done in that area are positive. And as I said before, there's a lot of people who aren't going to get tested because they have mild disease that looks like something else, that they think is something else, or they're asymptomatic and they're not going to get it. So if 80% of the people are having mild or asymptomatic disease, that 1 in 5 is those who are symptomatic and are severe enough to get tested or have some other reason to get tested. That's an alarming rate that needs to have some major community mitigation policies and procedures put in place.
Next question is for the whole panel here. We'll start with Dr. Labani. The biggest misconception right now about COVID-19 from your perspective?
That it's just a cold. It's not just a cold for 20% of people. You know, when you work in the hospital like us, you know, we see the sickest of the sick, and it's not just a cold. It's like I told you before, it doesn't act like the flu. It needs to be taken very seriously, and there are a lot of people getting really sick from this.
Dr. Charles?
I think the biggest misconception is that it's not real. It doesn't really exist. It's a figment of someone else's imagination for some sort of political gain. I think that's the biggest misconception I've noted. Having said that, I have colleagues and friends in New York City who have actually died. I have ICU attending physicians who taught me they've actually passed away from this. Nursing colleagues in New York City who have actually passed away from this. I think that the unfortunate reality is that until it hits home, it doesn't hit home. And now that COVID-19 is really, really here in our community and affecting us personally, I hope we can take advantage of the opportunities that we still have to wash our hands, wear our masks, and to get tested whenever necessary, and to socially distance, physically distance ourselves.
Well, very sorry to hear about that. And again, we appreciate your reminders and your perspective. And Dr. Cam, how about you?
That's a hard one. I think yes, that it's not going to hit here. It's not going to be us. It's not going to be that bad. And we're seeing right now that yes, it does. It hits us. It hits here, and it is bad.
Yeah. Kelly, I want to ask another question. I think this one came in from a community member here. You know, we're seeing on the maps, Michigan.gov, for example, of the tests that are positive, that are negative, and then a recovered test. What defines a recovered test? Just so folks know, we just heard that recovery can be short-term, long-term, but from a public health perspective, how are they defining those recovered tests?
So the state of Michigan counts recovered as that you are alive 30 days after diagnosis. And so it's quite some time. So when we look at the numbers, there may not be as many active cases, and often from a public health perspective, we're looking at who's infectious, and we want the infectious people isolated and out of the community so they're not spreading it. And so you may have recovered from your infectious period, but you haven't recovered to the point where the state's going to count you yet as a recovered individual.
Okay.
And that has to do again with, as the doctors both pointed out, of that it takes time between when you get diagnosed to then when that hospitalization occurs and when that severe outcome occurs.
Okay. Next question for Dr. Labonte. Thinking about individuals that do get severely ill, when they are severely ill, what is really driving the time needed for recovery? So this person's really getting at, as I'm paraphrasing here, what factors really influence that time to recovery? So they're ill, they're in the hospital, and you mentioned there's some variability, but what are some of the factors that might be contributing to how some people recover faster or slower?
Well, I think, you know, the main driving force is just the virus activity itself. I mean, I've been taking care of middle-aged, fairly healthy people on oxygen, and it takes a long time. You know, this virus just does not release its grip quickly or easily on people like we're used to seeing. As hospitalists, you know, we like to see people, you know, come in and get out within a couple of days, and this is not the case. You have to be very cautious and just patient. So, you know, that's the biggest factor. And then, of course, you know, age, other medical comorbidities. So if they have COPD or asthma, that can certainly get flared from this and complicate things. The disease severity itself, whether or not they're just on a little bit of oxygen or where they end up on a ventilator, whether they've developed a complication such as a blood clot, a heart problem, etc. So there are multiple factors, but I can tell you that the most predominant one that we're seeing is just the time it takes for this virus to just go away. It is, I keep bringing that up because I'm just in awe of how it works. I've just never seen anything like that before, where it just does not release its grip on people easily.
Next question for Dr. Charles. You mentioned many of the underlying health conditions. This person is asking, I have sleep apnea. Does that increase my risk for severe illness with COVID-19?
Studies so far have proven that sleep apnea does not ordinarily increase your risk to the point where you're at risk of having severe illness because of your sleep apnea. So the answer is no. Sleep apnea by itself does not put you at the category of being highly at risk of having severe illness with COVID-19.
Okay. Final question for the panel tonight. What's the most important message you would like our audience to take away from tonight's town hall? And Dr. Cam, how about we start with you?
I would say what we keep saying in all of these: wear your mask, keep physically distant, and wash your hands.
Okay, short and sweet, thank you. Dr. Labani.
I just want to reiterate that the hospital is a safe place. You know, if you need to come in for preventative care, a flu shot, or emergency care, don't delay your care. Come in, let us take care of you. Let us treat things hopefully while they're mild and we can get you back home. But if not, if you need to be hospitalized, it's very safe. We have a separate wing of the hospital for patients with COVID. They don't share nurses, they don't share aides. It's a completely separate area. And so you can come into the hospital and not even be exposed at all to anyone who's even taking care of a COVID patient. We have all of the proper PPE. We have everything in place that we need. So come in, get your care you need. It's safe.
Finally, Dr. Charles.
I would just like to echo the same sentiments from Dr. Lamonti. You know, if you have any medical needs, whether it be routine medical needs or any medical needs at all, our hospitals are a safe place for you to be seen by the medical fraternity here, to get the treatment that you need, to get the preventative care that you need. You will not get COVID-19 at our facilities, but if you do have COVID-19 and you need the treatment and the care that one would ordinarily need, we can provide that care for you safely.
I want to give a special thanks to both of our presenters tonight, Dr. Charles and Dr. Labani, along with Dr. Cam. We really appreciate everything that you're doing for the community and for using this platform to give us the credible information. A couple of quick announcements as we wrap up. I also need to thank our sponsors, UP Health System Portage, the MTech Smart Zone, the Upper Peninsula Power Company, and Aspirus, along with the Center for Educational Outreach and the Health Research Institute here on our campus. We greatly appreciate the support from our local sponsors and campus partners here. A couple more things. Thank you to the audience for tuning in tonight, both on the Zoom webinar and on 97.7 The Wolf. Remember, if you did miss any part of tonight's town hall, or if you'd like to go back and look at some of our previous ones, you can go to mtu.edu/health-research. A few other things. There is a drive-up COVID-19 testing coming up on Saturday at the Gates Tennis Center here on our campus. Again, you do not need a physician order, or a pre-registration is not needed. You can show up there Saturday morning. We've had a lot of questions come in tonight. We did our best to answer as many as we could. We know we left some unanswered, but we hopefully answered those ones that our speakers could give us more information about. Next week, our topic will shift gears a little bit in talking about how COVID-19 is impacting our physical activity levels and how we can be maybe more active. Dr. Labani mentioned things at home and deconditioning and how we can keep our community active during the pandemic. Finally, I want to thank several people behind the scenes: Kelly Christensen, Grace Schmitz, Jody Lehman, Cody Kangas, Cassie Munoz, and a special thanks to Lydia Lytle, who's a new mom, so congratulations to her family. We'll see you next Thursday at 7 p.m. Eastern here, right on the Zoom webinar and on 97.7 The Wolf. Have a great evening, and we'll see you next week. Thank you. See you guys. Thank you.